Mr. Small, I'm going to ask my questions to you. There's a whistleblower from the U.S. Customs and Border Protection that recently reached out to my staff indicating that the VA is paying for health care services provided to non-citizens in detention. A VA portal established for community providers to submit claims to the VA for health care for non-citizens includes documentation that this has been going on since at least 2020. ICE reporting to Congress references a, quote, service-level agreement between the VA and DHS for the provision of those services. Under what authority is the VA providing claims processing services to non-citizens at the border?
Yes, Senator, thank you. Thank you for that question. I'm not aware of these allegations. I will defer to my colleagues in Veteran Health Administration to see if they are aware of such allegations.
Are either of you aware of the situation Senator Moran talked about?
I am not aware of enrollment in beneficiaries or delivery of healthcare services being provided. I am aware of the support that VHA is providing to our veteran service members within Customs and Border Patrol, specifically counseling and making sure that they are able to continue to receive the services that they are entitled to.
That makes sense, Mr. Jackstead, to me, but I would be interested if you could follow up with a response. I'd like to make sure we're prioritizing the health care for veterans that we regularly hear about the shortage of providers, and I want to make sure that we're focused as our priority at the VA is on veterans. And then if I'm told as a copy, there is a service level agreement that I mentioned, and it would be useful, that's between the VA and DHS. It would be useful if me and my staff could see a copy of that agreement. And then, Mr. Small, I would think you would defer answering this question as well, and I say that with a smile, I'm not cringing at that. But you heard me mention the emergency transportation issue. It is an important one. It's an important one now. It's an important one when we have a significant emergency or national disaster in our country. We've, in February, the VA's reimbursement rates for air and ground ambulance services are going to be significantly reduced in accordance with a pending VA rule change. Ambulance providers across the country have told me that this will substantially reduce the availability of ambulance services for veterans and for other Americans. This is particularly an important issue for me as a Kansan and the rural nature of our state, and air ambulance service is hugely important in the delivery of a patient to a regional hospital. I understand that the VA is considering delaying implementation of that rule, and I indicated in my testimony that the Chairman Tester, and Senator Bozeman, Senator Murray, we've all been calling on the VA to do so. I've been asking the VA for the last month for clarity on their path forward and yet to receive a response. My question is the VA intending to delay implementation of the rule to reset reimbursement rates for emergency transportation services beyond the current February 2024 effective date?
Yes, Senator, thank you for that question. Yes, my colleagues in VHA do manage a patient movement program for the department, so I will defer to my colleague, Derek Jostad, for a response.
Ranking Member Moran, while I cannot speak to the day-to-day transportation, I can speak to what we are doing within the realm of federal patient movement. As the Executive Director of the Office of Emergency Management, the efficient, timely, and consistent ability to move survivors of disaster or our uniformed service members to definitive care is my #1 priority. We maintain 48 federal coordinating centers, as well as hundreds upon hundreds of NDMS partner facilities. Over the last 18 months, I am very, very proud of the number of full-scale exercises that we have had the opportunity to conduct, reestablishing relationships within healthcare coalitions, within our emergency medical service providers, as well as with other community partners. And so when we speak of the need to move patients, especially those impacted by disasters or other events, I am very confident in our ability to ensure that those survivors are reaching definitive care. Happy to take the transportation question on the day-to-day back for record.
Mr. Jackstad, would you, or Mr. Small or Dr. Dorsey, would you visit with my staff at the conclusion of this hearing and see if we can find a path forward to get information from the VA with your assistance?
Yes, Senator.
Thank you all very much. Thank you, Mr. Chairman.
Senator